Okay, folks, we're day 4 now with Parker, and as you can see here, we're doing some laser on him. He had a little bit of a flare-up yesterday after going out and having a few cocktails during the weekend. How did you do since our laser session yesterday?
Too good. Slept a lot better.
Okay.
Definitely feel a little more relaxed today. Swelling in the chest went down a little bit. Making some progress.
Good. Okay, he did not take a laser home. He didn't take one of our rental lasers. So we're just lasering him here once a day. But you can laser up to 2, even 3 times a day, as long as it's about 6 hours apart. And we're gonna flip him over here on his stomach in just a second. Now, we have you here for a couple more days, right?
Yep.
So starting tomorrow, we're gonna go deeper with the laser. And you don't wanna do that right off the bat because that can stir up some inflammation. So we started inhibitory at 1,000 hertz first, and then on his next visit tomorrow, we're gonna go ahead and lower it to between 5 and 250 hertz. And we might do a sweep, so it'll hit different depths of the tissue. It's really important not to stimulate when you're first dealing with costochondritis and inflammation. Laser, you can have a laser at a lower hertz, 5 to 50, and it will reduce inflammation, but it stimulates. And initially when someone's in pain, that can be very painful. It can increase their pain. So you want to start off at 1,000 hertz and then go down to a lower number once he's used to it. A few more seconds here. So we have an ice pack here that we put on his chest. If any of you are having a costochondritis flare-up, a good thing to do is take a large ice pack, put it on your chest, keep your shirt on, and put some heat on your upper back. And you can either lay face down or face up, doesn't matter. Now with this, the front here, we're gonna scan his chest. This helps me find the areas of inflammation, and I'm sure we're gonna find something right here. There we go. Let me get you some glasses, Parker. Here you go. This is one of the safer lasers, class 1A, but you just don't want to stare at the laser light. Not good for the eyes. And we'll scan here along where the rib head meets the breastbone or the sternum. So this is the costochondral junction. And same spot, it beeped over again. That's why, again, I go over the same spot 2 or 3 times. You getting your fill of New York City?
Yeah.
Good.
I like this laser.
What's that?
I like this laser, how it can find.
Yeah, it's pretty neat. And we're going to scan down, and then we're going to check the rest of his pec muscle. It looks good. And the rest of the spots here. Scan it again. Just... And when you're dealing with over the rib area, and there's just not a ton of soft tissue right in this spot, you really want to do a few scans over the area. It works better when there's a lot of dense, muscle tissue underneath the laser. This can be a bony area where your breastbone is. Now we're going to go further out where we have more soft tissue. It beeped there last time too, right there at the pec minor. I don't know if you remember that yesterday. Mm-hmm. And how did it feel afterwards?
Felt a little bit better actually.
Yeah, so a TENS unit, what he's talking about is a TENS unit. TENS units can be really effective for some people. For others, it's not effective. So if you're someone that suffers from costochondritis, it's certainly an option. You can put the TENS unit on. You could also, not only on your chest, but you could put it in between your shoulder blades there. Just make sure you know how to use it. I've done a video on how to use a TENS unit, and I hope some of you will find it really helpful it's important to know how to use it. But they're cheap. They're not, you know, they're $50. The more you spend in the $50, $60 range, you'll get a TENS EMS unit. So TENS is for pain. TENS tricks your brain into thinking that you don't have pain. EMS helps with muscle tension, muscle spasms. So really, anybody with costochondritis can benefit from both TENS and EMS. If I were going to spend the money, instead of spending 30 on just a TENS unit, I would spend the extra 20 bucks, 20 to 30 bucks, and get the TENS/EMS. You can get them all over Amazon. We have them here. We sell them here. Really easy to use and helpful. And not just for costochondritis, obviously. And they rarely make just TENS units by themselves. They usually come with they make TENS units by themselves. They rarely make EMSs by themselves.
Like,
right in there. And it didn't beep over there, but we'll run this back over that spot again. Right there? Okay. And again, it works better over tissue, right? So there's a lot of bone in there. But yeah, I felt like there was too, but we didn't see it beep over that spot, so we'll check it again.
A little puffy last night, and then it went down a little bit this morning.
Okay.
It's amazing what sleep can do.
Yeah, body repairing itself, right?
Seriously.
We've had patients in here before that can't sleep. Can you imagine? How do you function?
Yeah, I know. I've definitely been going through that. It's not fun.
Where you can't sleep at all?
Yeah.
Okay. Have you had any of those sleepless nights in the past few days since you've been seeing me? Yep, there you go. The beep.
Yeah.
Good call there. Okay.
Everything's pretty accurate.
Yeah. It's incredible. You know, we'll have somebody come in with tennis elbow, for example, and I'll scan the whole arm, and it won't beep until we get right over that tendon right there, you know, on the corner of the elbow. You know where tennis elbow is, so.
My buddy has tennis elbow.
Does he?
Yeah.
This is really helpful for that. Tell him to find somebody with a cold laser to help him with that.
What's a cold laser?
That's what this is.
Yeah.
It's also called low-level laser therapy.
Why is it called cold laser?
Because it doesn't heat the tissue up.
It's not cold, but...
Well, it's not cold, you're right. It actually heats the tissue a little bit, you're right, to some extent, but it doesn't heat the tissue like a hot laser would, where it's not super pulsed. This is a super pulsed laser, so you don't, you know, overheat the soft tissue.
Huh.
Yeah, we're going to check his clavicle again, folks. Last time it was balanced. It was good yesterday. So let's check that real quick, actually. We'll have you stand up. There we go. Okay, I'll take your glasses. Let's have you stand up. Let's check the clavicle. Okay. And it is out of place again. See that? If you zoom in, you'll see this thumb here is quite a bit higher. So we're going to have to adjust that again today. Okay, you can put your shirt, well, it's up to you. I mean, I could just pull the front down too. Lay on your stomach.
Maybe it's from sleeping on my side?
Yes, very commonly it could be sleeping on that side though. So,
I only sleep on my right.
okay, there, yeah, it would definitely be from that probably.
Yeah.
Obviously, I checked you what time yesterday in the afternoon, and it was fine yesterday, so I'm kind of thinking that might be the reason why. What's your pillow like?
Well, I don't have my normal setup like I do.
Oh, that makes sense. Take a deep breath in and blow out. And again, deep breath in and blow out. Turn over on your back. Keep going. Yep. Cross your arms in front of you. All right, now tuck your chin down. Take a deep breath in. Come on up. And blow all the way out. There we go. Back down on your stomach. So that adjustment you were talking about that you like, where I tilted your head to the side.
Yeah. Any chance you could do the...
Yes.
This one,
You're talking about this one.
Yeah, that one.
relax yourself here.
And then you're just doing like you're like stretching my neck, and then also like.
Okay. How are you making out with a lacrosse ball stretch?
Yeah, you gotta. I'll do it for you. You gotta listen to how much muscle.
Crunchies there are? Yeah. It helps, right?
Yeah.
Now that you're used to it, you could probably spend a few extra minutes doing it. Okay, turn over on your back. Gonna do something a little different here. Bend both knees for me. Y strap. Okay. So we're just gonna traction your neck out a little bit here. Bend, or lift up your head for me. Drop it back. How are we doing there, okay?
Uh-huh.
So this Y strap is traction, cervical spine or neck traction. Lift your head gently and drop it back. All right.
That right side's a little sore.
This side?
Uh-huh.
Yeah. Okay, so I'm going to help avoid cupping on your chest. That will leave bruises here. We don't want to do that for you just yet, but that's an option. Since you're doing really well, we don't need to do that, but you can also do cupping here.
Yeah.
You can buy a cup, you know, the digital cups. It's not going to be as sensitive because we lasered it. Okay, now I'm going to have you sit up, face that wall. So now, folks, we're going to do a little bit of ART on his rotator cuff muscles and his traps. So I'm going to start you out bending your neck to the left. Nope, bend it to this side. Yep, and then away from me. Good. And again. Good. Probably hard for you to do that. This is intense, guys. I did another video and showed you how to do this on your own. Make sure you check that video out. If you suffer from headaches or neck tension, this is a great ART stretch that you can do yourself. But you got to watch the other video. We're not teaching you how to do this yourself in this video here. We're just helping Parker here. Good, good, good. Keep going. Intense, huh?
Yeah, that's like the same thing as this almost.
Just as bad, huh? All right, one more. To this side.
Yeah.
Yep. And away. And slightly forward. There we go. Okay, now we're going to do the front because your clavicle pops up on this side. So now tilt here. Yep. And away. Good. So just in case his SCM muscle's pulling and tugging that clavicle upwards, we're going to fix that here just by releasing that SCM muscle and the anterior scalenes. And again, no, I want you to tilt to this side. Yep. And away. Again, you hear him moaning and groaning. This can be intense. And again, one more. Good. Stand up, face the camera. So let's see if his clavicle corrected just from doing that. Then that tells me a lot. Right over, yeah, right over here. Look at that. It did correct about 50%. So that is part of his problem. Okay, come on over here, lay on your back. Turn your face that way and look that way. Okay, so here we go, a superior clavicle. Pretty easy to adjust. I tend to like to adjust people with a clavicle on their side sometimes as well. We're gonna see he's responded really well to this type of adjustment. Let's have you stand up. And now we're gonna compare it one more time. And look at that, much better. Not perfect, but much better. So I want you to lay on this side. This is the other way I adjust it. This way tends to be more effective. I don't want him sleeping on this shoulder, as this is not good for his clavicle. This tends to put it out of place and make it rise up, superior and medial. So we're gonna go ahead and just relax here. Okay, and come on up. There we go, much better. Not perfect, but much better. Okay, now one last drop. Lay on your back, face that way. Slide up a little bit. No, up this way. Up this way. Yep, little, there we go. Okay. All right, you're all set until tomorrow, okay? Check day 5 tomorrow.